What should I do if my eyelid still does not fold even after double eyelid surgery? I had undergone double eyelid surgery 6 months ago. In about 4 months through recovery, the crease on my right eye started to become less visible. The crease on my left eye, however, is fine. I was suggested to undergo a ptosis surgery to help form the fold on the right eye, but I am not sure if I would like to go through it, as my right eye is not at all droopy, and is also my dominant side.
Thank you for your question. You described that you had Asian eyelid surgery 6 months prior, but that 4 months later, one of your eyelid creases became less defined. Now, that's certainly something that can happen and does happen, but it was interesting that you also wrote that it was suggested that you undergo ptosis surgery to do some type of correction. And with the photos you submitted, it doesn't appear from what you submitted that there is any significant ptosis on the side that doesn't have as well developed a crease. I'm a cosmetic oculofacial plastic surgeon. I specialize in cosmetic surgery of the eyes, and Asian eyelid surgery is an area that I focus my practice on amongst many other specialty areas. So when you do incisional Asian eyelid surgery, which it appears based on the slight redness that I see in the crease, that the goal of whether it is incisional or non-incisional Asian eyelid surgery, it is critical to create some type of connection between the skin and the muscle called the levator muscle, the muscle that lifts the eyelid. Now, it is occasionally when this area heals, even when you do anchor the skin to the levator muscle, the skin can pull away and it can become less, the crease can become less defined. Now, in my practice, I always have to individualize when something like this occurs, but in general, it's not about removing more skin when someone is relatively young and you've already had some skin removed. It's about restoring that connection. So if someone has, whether they had the incisional or the non-incisional approach, I will try to do a revision by just doing the non-incisional approach by trying to anchor through openings in the eyelid skin using that method to restore a connection to the underlying muscle. There are many factors that can cause what you're going through, and it is anybody who does Asian eyelid surgery would be certainly familiar with this. It's just a matter of creating that connection, and once that connection is created well and the crease folds in, it tends to hold up and last a long time. So I think it's important that you discuss this with your doctor and review with your own photos and maybe your preoperative photos whether or not there is a change. Maybe your doctor feels that your eyelid is slightly lower than it was before, but there's no previous photo submitted with your question, I can't address that as a change. But and it may be that your doctor is saying that you need a procedure that's like a ptosis surgery, because ptosis surgery also involves the levator muscle, the muscle that lifts the eyelid. So there may be some misinterpretation. It is not uncommon for patients to walk away and not fully understand everything the doctor was trying to communicate. There's only so much one can absorb, and I've had patients who are physicians and they don't remember everything I tell them. So we ourselves as doctors are guilty of the same thing. So it's nothing, there's no judgment there. But I think that as a suggestion, you may ask your doctor about this non-incisional approach to try to restore the crease. But physical exam also is critically important. If your doctor feels that maybe there's some scar tissue that needs to be addressed, or maybe there's something else that has to be done. Again, the doctor who did the surgery knows your eye and knows what they came across when they did your surgery. So Clearly, there is some indication for an enhancement to maximize symmetry. It's a matter of figuring out what is the best procedure for you. So I hope that was helpful. I wish you the best of luck, and thank you for your question.